We're here inside of Airside F at Tampa International Airport. This is the second night that Haitian medical evacuees are coming to Tampa for medical care. These folks are coming in with some very serious injuries. They're being brought in on a military aircraft. They'll land on the tarmac outside, come through this room, be triaged, and be transported to Bay Area hospitals. We're going to see a lot of activity moving through this room here in just a short while, but before that starts, let's talk to some of the people involved in caring for these medical evacuees. Fire Chief Dennis Jones is on hand to make sure the operation flows smoothly. Chief Jones explains to us Tampa Fire Rescue's role in this operation.
Fire Rescue's role here tonight is going to be to triage, treat, and transport the patients that are coming off of this aircraft. Patients coming from Haiti that have various levels of need, various medical conditions. We'll triage, sort through them here, determine which are the most critical, less critical, immediately begin treating them, and then provide transport to an appropriate facility.
In addition to paramedics from the fire department, other medical professionals are present to assist with the medical care these evacuees so desperately need.
We have two groups that have come. One is the residents and students from USF that have come to help and that are in emergency medicine, and we also have volunteers from the Medical Reserve Corps here with us tonight from other hospitals. Dr.
Karuba told us a very important group here this evening is the Medical Reserve Corps. But what is the Medical Reserve Corps? Nurse practitioner Beverly Brown of the Polk County Health Department explains.
The Medical Reserve Corps was founded in 2001 after 9/11. It was part of President Bush's initiative to recruit healthcare volunteers, public health volunteers, to assist their community during times of disaster, but also to assist in maintaining well communities.
Once the evacuees arrive, medical staff will conduct a triage of their injuries. Triage is a procedure in which the staff reevaluates the patients, determines their current medical condition, and routes the patient to the hospital best suited to serve them. The personal protective gear we see the medical staff wearing is for the safety of the patients and the rescuers. As the airplane comes to a stop on the tarmac, with more than a dozen severely injured patients inside, the paramedics meet the flight crew at the rear of the aircraft to get a status report on each patient. Representatives of the Transportation Security Administration and the Customs and Border Patrol were on hand to help assimilate the Haitian nationals, both young and old, into the United States. The medics then carry the patients to a triage area set up inside of Airside F at Tampa International Airport. As the evacuees are brought inside, work in the triage room progresses in a calm and effective manner. This level of professionalism has been gained by both experience and training. Fire Chief Dennis Jones explains.
Tampa Fire has done an evacuation like this before. In fact, in 2005, we received a lot of the evacuees from Hurricane Katrina, a flight that came into Tampa. We did the immediate medical screening, immediately medical screened them and began treatment, and then had the transport unit standing by to take them to appropriate facilities.
Even those rescuers who may not have been involved with the 2005 Katrina efforts have had an opportunity to practice and perfect triage techniques.
At least once a year we exercise our mass casualty. We have a mass casualty exercise in which we muster all the forces that you are seeing right here, all the different agencies, and a collaboration effort of assessing, treating, and transporting patients to various locations. So really this is just putting all that practice into a real life scenario.
The question then arises, how well does the practice at the training scenario translate into today's real-world situation?
That's the beauty of having these annual exercises is you know each other, you know what they look like, the other partners in your group, your other community partners, and you're working with private ambulance companies, county fire rescue, all these collaborative. No one agency can do this. You must rely on those joint resources, and it's really good to have that work.
One of the challenges facing the medical crew this evening is a language barrier. Not all of the patients speak English. The Medical Reserve Corps assured that translators were available.
A lady who speaks Creole is going to be at the red area with the folks who are mostly injured, and we're going to have a couple of them on the tarmac when those folks first come off the plane.
When the medical team has completed their evaluation and triage, the patients are carefully moved onto ambulance stretchers and prepared for a trip to the hospital. Outside, the ambulances keep coming around. It's a controlled chaos. We have a chief officer out here who's keeping the ambulances moving in a free-flowing fashion to make sure that all the patients are quickly sorted inside. Their hospitals are assigned, they're moved outside and off to the hospital to give them the care that they need. Tampa Fire Rescue Assistant Chief Scott Ellers is coordinating the ambulance traffic.
The biggest element on this portion of it is to try and keep the line of communications open between the transportation area inside the building to the staging area where the units come into. And then once they give me an idea of what type of units they need and where they're going to transport to, I relay to them the request so they can send the right unit down here.
Outside the triage area, there are 2 different types of ambulances being utilized to help move the patients: basic life support ambulances from private companies and advanced life support units from Bay Area fire departments and the Sunstar ambulance provider in Pinellas County. As mentioned, the patients are being transported to hospitals that can best help their needs. For example, burn patients are going to the burn center at Tampa General Hospital. Most of the patients have gotten off the aircraft, been evaluated here in the triage area, and have worked their way out to the ambulances and are on the way to Bay Area hospitals. This operation has been going on for nearly 2 hours now. Firefighters, paramedics, doctors, medical staff throughout the Bay Area have worked here tirelessly to transfer the patients smoothly to the Bay Area hospitals. This is truly a regional medical effort. Over the past several days, these Haitian medical evacuees have been through some terrible trauma, both physical and mental. The medical staff is taking this into consideration as they prepare to help.
Well, you know, Tampa Fire is very proud of our tradition of serving the citizens of Tampa, but it really does, it gives you a good feeling to be able to help someone from a country that has been so devastated. There's been so much loss of life, so much damage to the country, and now at least a few of these citizens are coming to Tampa, and they're going to be able to get the kind of treatment that they need, and they'll get that treatment because of the men and women of Tampa Fire. It makes me very proud to be a part of it.
Well, it makes all of us feel pretty good to do this. It gives you a good amount of self-worth. They're very, very injured, and they've had such a bad time already, separated from their family and everything like that. So anything that we can do to help them in any way really does make us feel good.